colds, flu, icy pavements, hazardous roads. It's that time of year again when the bugs and the weather can cause absolute havoc with our daily lives. And every year, of course, it will also put extra pressure on Cumbria's hospitals, the GPs, and the many other groups and people who will look after our health. So what do they do to get ready for this busy period? Well, throughout the day, we're getting a snapshot of healthcare in our county in the run-up to winter. BBC Radio Cumbria's John Bowness is with one of our county's GPs right now. Morning, John. Where are you?
Yes, very good morning to you, Mike. I'm spending the next few hours, actually, with Carlisle Healthcare, which looks after more than 40,000 patients across 3 sites here in Carlisle. That's one of them at Eden Street near Morrison's in the north of the city, and at St Paul's right in the city centre, and the new health centre off Easton Way in Harrowby. That's where I am this morning. It's purpose-built. It's a big building. I mean, as you arrive, it looks like quite a decent-sized office block, to be honest. As you come in through the automatic doors, it's very kind of light and bright and airy and so on, and immediately warmer, even on a cold morning like this. It's not too busy just yet, as I've just come in through the entrance there. Not too busy yet, but it's obviously going to get that way. And I'm joined this morning to start with by Dr. Robert Westgate, who's the clinical director here and also a GP as well. Just, Robert, good morning. Just to get a sense of what goes on here first. It's not really what people might think of as a traditional GP surgery, you know, with a reception desk and 3 consulting rooms and kind of that's it. You've got lots of GPs across all your sites. You've got about 25, I understand. You've got pharmacists, you've got paramedics, you've got physios. What's the idea of sort of having so many different kind of health workers all in one place?
So morning, John, and welcome to the surgery, and a pleasure having you with us throughout the course of the morning. So general practice has been on something of a journey this past 10 plus years, and some of that has been around thinking about the number of GPs in the system, who's retiring, etc. And in the past 10 years or so, there's been quite a drive to have a mix of different staff to provide clinical services. So as you mentioned, we've got a variety of different staff members on site. We've got GPs, we've got advanced
We appear to have lost
and to support people with their needs in general practice. And you mentioned we've got this new site that we've been in for a couple of years at Durham Hill. Looking back over the years, we were 3 separate GP practices in Carlisle, sort of just over 10 years ago, and for a variety of reasons, but particularly the stability of services and the number of GPs in the system and challenges with retirements and recruitments, etc., we came together to build some resilience in general practice. And now, almost 10 years on, with Carlisle Healthcare, we've got about 40,000 patients operating from 3 sites. There's some resilience with that scale and some stability with that scale in terms of the offer that we want to make to the people of Carlisle.
Let's talk about how people actually get an appointment. There's been a lot in the news recently about the so-called 8 o'clock scramble, you know, when people all phone a surgery at 8 o'clock hoping to get an urgent appointment, you know, same-day appointment then. Some patients in England have told the BBC it's virtually impossible for them to get appointments. How big an issue is that for you, and how do you cope with that?
So access and capacity are really challenging issues in general practice, and I think it's fair to say that demand tends to outstrip supply. One thing that many practices have done in recent years, and most practices, well, all practices have been asked to do under contractual arrangements since October, is putting a total triage system, which means assessing someone's need at the point of contact, be that online, walk-in or on the phone, making an assessment of that need and then making an offer based on what the need is, which might be signposting to another service, for example, community pharmacy, it might be self-care, it might be a same-day face-to-face appointment, it might be a telephone appointment, it might be a future appointment with a clinician that knows the person. So that total triage model helps us to make the best of the capacity we've got by trying to prioritise and make the best offer based on that person's needs. But it's very challenging because the capacity isn't always there to offer the service that we would want.
Well, I was going to say, this is the theory of how it all works. I mean, is it working for you in practice?
So we've been running a total triage system in a number of different ways, probably since before the pandemic, and we streamlined that 2.5 years ago when we adopted a new online system. So I would say it's working for us. It seems to be working for patients. About 75% of our people who approach the surgery contact us online. The remainder contact us either on the phone or by walk-in, and then a decision's made based on the request and the nature of the request. So it's busy. So far this morning, we'll have about 100 contacts in the first hour. They'll be filtered, offers will be made, some will be seen today, some will be signposted elsewhere, etc., etc. But I think part of the principle of triage is bringing a degree of order to what's otherwise chaos, to try and make the right offer for the right people with the right urgency, with the right bit of the service.
OK, for now, Dr. Robert, thank you very much for the time being. One of the things we're going to be talking about this morning is winter pressures, and we'll kind of come on to that a little bit later on in the morning, and kind of how the NHS is coping and is expecting to cope. So that's Dr. Robert Westgate, GP and Clinical Director here at Carlisle Healthcare. Sorry, I was going to say Carlisle Health Centre, Carlisle Healthcare. Thank you very much for the moment. There's plenty more to talk about this morning, Mike, from common winter ailments and where people can get the help they need, to staff recruitment, how to keep your own doctors and nurses well during the winter when they're treating so many people. And if I'm lucky, Mike, they might even squeeze me in for a quick health MOT to make sure that I'm up and running, ready for winter.
Well, let's hope they can, John. Let's hope they can. By the way, John, just whilst you're there and you've got Robert Westgate with you, Mike's been on. He says, Carlisle Healthcare, we hear about appointment troubles, but these people are absolutely brilliant. So you might want to just pass on that compliment to Robert Westgate from Mike, who's got in touch this morning, John.
I certainly will. We've had a listener get in touch who's already singing the praises of the centre here. So that's really, absolutely brilliant, I think, was the way he described you all.
That's very kind, thank you.
Nice one.
Great stuff, Mike.
All right, John, thank you. BBC Radio Cumbria's John Bowness at Carlisle Healthcare on Easton Way. And we'll keep dropping in on John throughout the course of the morning to hear from some of the many people who work in our county to keep us fit and healthy.